Ophthalmology Exams and Procedures lecture. The complete eye examination begins with an ophthalmoscope, which projects light into and views the interior part of the eye and retina. Eyelids examined for edema, and pupils examined for shape, symmetry, reactivity to light, and movement coordination. Also used is the acronym PERRLA. A slit lamp biomicroscope is used to detail the eye and requires mydriatic eye drops. Mydriatic eye drops dilate the pupils for this examination. Exophthalmometer measures how far the eye protrudes beyond the edge of the socket. PERRLA, what does it stand for? It stands for pupils equal, round, reactive to light, and accommodation. Distance visual acuity. The best single test for vision screening used with the Snellen alphabetical chart. Patients must be able to view the chart at eye level from a distance of 20 feet in a well-lit area. Gross screening for visual acuity, the patient usually is allowed to use glasses or contacts. Document the use of corrective lenses and result each eye separate and as fractions. Outcomes of the test with appropriate abbreviations, and we will discuss this in a little bit. Recording the results, eye abbreviations. So the common eye abbreviations are OD, OS, and OU. OD stands for right eye, OS stands for left eye, and OU stands for both eyes. I remember these by OD, D at the end, and then R at the beginning of right equals doctor. So I always remember OD as the right eye. How you will record the results of the test. So the numerator is the distance of the patient from the chart, which is always 20 feet unless you have a different chart. The denominator is the lowest line read satisfactorily by the patient. For example, if a patient reads the line 20 at 20 feet, the fraction would be 20/20 and is recorded for that eye. The last line the patient can read without squinting or straining and with no more than 2 mistakes is the line recorded in the patient's chart for that eye. If the patient makes 1 mistake, it would be recorded as 20/20 minus 1. You, of course, then, in correct documentation, you would have the date and time, OD 20/20 minus 1, OS 20/20 minus 1, and OU 20/20 minus 1, and then sign your name. You also might want to indicate in your documentation whether they were wearing corrective lenses. So here are the different distance visual acuity charts. Sometimes we use the chart for symbols in children that might not know the alphabet yet or not quite 100% on their reading skills. So we will have them read what pictures they see. Here is the regular chart that we normally use for any adolescent or adult. Sometimes you may get an adult that cannot read and does not know the alphabet. However, this is rare. We would then use the E chart, and the patient would point which direction the E is on the chart. Near visual acuity. The patient holds the card 14 to 16 inches away from the face with varying size fonts. The test is for each eye with the other eye covered but open. Document the number in which the patient stopped reading for each eye, whether corrective lenses were worn, and any signs of eye strain like squinting. Screen patients for presbyopia and hyperopia. Here is an example of the Jaeger near vision test. And as you can see, the different size fonts and the number above them. You would then record which paragraph they last read with less than 2 mistakes. The Ishihara color vision test is a test that detects a defect in color vision. Usually this is congenital and sometimes acquired. In congenital cases, males are more susceptible to color vision inadequacies. Sometimes with acquired vision, usually this happens when there is damage to the cornea in the cones of or damage to the retina, I should say. So damage to the retina where there is damage to some of the cones where the color receptors are. The Ishihara assessed perception of primary colors and shades of colors. The polychromatic plates with numbers of one color and the background dots are a different color. If a patient does not know their numbers, have them trace the number with their finger. This is equally as acceptable in this test. If the score is 10 or higher, the patient is within average range. Here is an example of how the Ishihara test is done and what the plates look like. Treatment procedures of the eye. Eye irrigation. Use sterile technique and equipment to avoid contamination. Used to relieve inflammation, remove drainage, dilute chemicals, and wash away foreign bodies. Never attempt to remove the foreign body with an applicator or a tweezers. Installation of medication to treat infection, soothe irritation, and anesthetize eyes or dilate pupils. Eye drops or ointments are common, and it is important to not touch the actual eye with the applicator. This can cause contamination among the eye. Aseptic procedure in ophthalmology. Avoid contamination of eye medication applicators. A new set of eye drops should be used for each patient, and if there is leftover eye drops, send them home with the patient. Sterility of the medications is crucial, and they must be labeled for ophthalmic use only. Safety precautions. Never attempt to remove a foreign body from the cornea using an applicator. Scratches of the cornea may result and cause scarring formation or impaired vision that is irreversible, unless you have a corneal transplant. Safety alert. Whenever the medication, the dispenser should never touch the eye while the prescribed amount of medication is administered. This can traumatize the eye and can contaminate the medication application.